Is it possible for children with autism, especially for the profound, is it possible for there to be any intrinsic motivation to do things?
Many times their heart and soul is gloriously awake. They
Mhm.
are just failed by a body that does not respond and do what it wants.
Okay.
Right? So, in that whole example, where is the displaying of intelligence in the motor control, in the actual pointing? So, the assumption was that the child with autism had complete motor control. And motor control is technically an issue relating to the autism
Hmm.
diagnosis, right? So this is where it gets very, very difficult. So a child with profound autism who might be rocking and maybe moaning, or they might have different vocal stems, they might look like they are not paying attention whatsoever, but there is a large brain body disconnect. So their body is doing one thing and their brain is doing another, and most times their brain is sitting there listening to you teach them. And it's only once kids are able to communicate, especially in this profound area of autism, just parents' minds are blown as to
Mhm.
how much their child had been learning all along. And this is really that cutting edge aspect of autism. So doctors are really trying to understand more and more apraxia and dyspraxia and how that relates to an autism diagnosis, because many times kids with autism also have either apraxia, which means they have very difficult time controlling the motor relating to speech, or dyspraxia, which means someone has very difficult controlling the motor of their entire body. So that would explain the whole, oh, was not able to point. I couldn't get my body to be focused and to be attentive and to point exactly at what I want. Sometimes kids will go to point and you'll see their finger just like whoop, kind of drift. That's the body, that's not the intellect. So it's really important to be able to see a difference between the two.